Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Matthew Sherrer and Martin Nowak. Matthew is an anesthesiologist. Martin is a healthcare consultant. The Kevin MD article they wrote is Trust in American Healthcare, What's Driving the Decline? Martin, Matthew, welcome back to the show.
Thank you.
Thanks, Kevin. Good to see you.
All right. Martin, let's start with you. Tell us about this article for those who didn't get a chance to read it.
Sure. Matt and I discuss frequently about comments we hear from patients or from my clients. And much of that recently in the last year has been a dissatisfaction with healthcare. And in trying to tease that out, there is some literature about this, and we cited some in the article. But the real issue here, we think, is Matt's coined the phrase narrative medicine, which we think is very important. And a great issue behind the lack of trust in both hospitals, physicians, other care, and certainly insurance is that the communication is so poor. One of the things I did to help us with our article on Kevin MD was I asked a bunch of people at the coffee shop, just wherever I was, do you trust your doctor? Do you trust your hospital? And regrettably, not a single person said, oh, wonderful, 100%, it's great. And all the answers were hedging. And so Matt and I began researching the literature, and much of the literature looks at single slices of the pie. Is it the cost? Is it access? Is it whatever it might be? But when you talk to the families and the patients, it's really some combination. And I think we came up with a conclusion that we're kind of in a perfect storm of many things colliding at the present time. Part of it began with COVID, the pandemic, and part of that had to do with mixed messages out of our leadership in Washington and so forth. But part of it also is declining reimbursement for physicians, and they don't have as much time. That's really a bad thing, because the whole key is of course history and physical, and the history part's so important, and the connection. Just this morning, Gallup published an article, their research view of the U.S. healthcare quality declines to a 24-year low. And the people in their survey cited cost and access as the first two things. And I'll just close this part and turn it over to Mark to Matt by one other thing, that I've been visiting a family relative in a local hospital that I trust, that I like. I trust the doctors. But in the waiting room, I asked families over several day period, well, do you trust this hospital? And I got answers like, well, it's the one in our neighborhood. It wasn't, oh yes, it's a wonderful thing. And then I got, yes, it's very expensive to be here. And then what really put the cement on some of the things Matt and I wrote about is that the patients really didn't know who the doctor was. That didn't mean the doctor didn't come in. They're busy, and there were like 5 partners in the group, and each day a different partner made rounds. And they had to be concise in their work. No issues with that. I had the same thing with the family member I was visiting. But they didn't know who the doctor was. They didn't know who the nurse practitioner belonged to. So it was just this whole communication of how one introduces oneself. Matt, your comments?
Yeah.
So let me ask you, Matt, do you feel that lack of trust, speaking through the lens from the physician standpoint?
Yeah, unfortunately, I do. I hate to give Martin credit for anything on these types of things, but he's right on this one. And our communication between, we're good friends, and it's usually, hey, Matt, you doctors need to do better at this. And I've, of course, always turn that back around. Hey, Martin, you admins and consultants need to do a better job at this. But unfortunately, I do feel what he's talking about. Patients are angry a lot of times. We make them wait for long periods of time. We're hard to access. Care gets denied. There's so many other factors that more and more commonly, when I visit people in the pre-operative area, I walk in and it's pretty apparent right off the bat, they're angry about something. So yeah, it's something that's becoming more prevalent. Martin did a great job of kind of laying out many of the factors, and we certainly don't have a magic bullet to fix all this. This is a complex problem, but definitely seeing it on the clinical side.
Yeah, and it's really stark how much that anger and patience really manifests. recently, of course, we have the tragic murder of the CEO of United Health. And if you look it up, the comment section of one of those articles, zero sympathy for that CEO's family, all of it about the anger towards United Health and the healthcare system.
Yeah, I've gotten text messages on that today. Same thing, my friends outside of healthcare. There's a lot of vitriol out there. Certainly thoughts and prayers with the Thompson family and with the United Healthcare family as well. Terribly tragic event that just underscores, as you said, Kevin, the vitriol that's out there.
I see the vitriol. Yesterday, I actually looked at LinkedIn and Reddit both just to see what the comments were. They are very much alike. It's only the method and the manner in which the vitriol is expressed on those two social media places. And I was quite astounded just how angry those responses are. Yeah.
Yeah.
So, Martin, when you talk to those patients at the coffee shop, just give us a sample qualitatively of some of the comments that they said when you asked them whether they trusted their doctor or hospital.
Sure. Obviously, they would say it costs so much. My insurance costs so much. It's the whole cost thing. One of the areas, though, that I took from them is that they believe the doctor is the captain of the ship.
Hmm.
But more so, they believe the doctor should be the captain of the ship. And I believe that. Matt will confirm that I have no issues with that. And they find that their doctors are not able to be the captain of the ship. Insurance denials, days in the hospital, the case manager, and nothing wrong with case managers. They come in within hours of admission and begin talking to the patient about getting out, and the patient and the family are concerned about being there in the 1st place. And so we're rush, rush, rush. And the next day, a different doctor comes in, and the case manager comes back in, and the doctor may come in and say something was denied. It's and now one thing we didn't mention is we are reading more and more about fraud, just outright fraud, upcoding, charging for things not done. This then adds to the whole thing. But I find it a tragedy that the doctors are no longer the captains of the ship.
Matthew, how does this vitriol and dissatisfaction in our healthcare system, how does it affect the patient care that you give, knowing that sometimes the reason for the vitriol is out of the physician's control, right? It's sometimes because of the health insurer, the denials, the pharmacy benefit plan. Sometimes you're not in control of the cause of the vitriol that of the patients that you see. So how does that affect you?
Yeah, we're not in control many times. And one thing I try to come back to, it's easy to get angry yourself in that situation. And so I try to tell myself, hey, you are in control of your response, right? You're not in control of what's given to you, but you do get to control how you respond to that. One of the things Martin said that I think is true is this rush, rush, rush. And so I've tried to really make a point of late to say, you know what? Being a patient's hard. I've been on the other side. I've had a sick family member. I had a son that was in the ICU for a long time. Being on the patient side of things is very, very hard. Anytime I see residents or colleagues frustrated with their day, easy to point out, hey, no matter how bad your day is, it's not as bad as your patient right now. Being a patient, incredibly, incredibly hard. And so trying to have that mindset of they're going through something, I can at least come at them with empathy, right? I can certainly come at them and treat them in a way that's respectful. And so what I've started to do recently, it's kind of become my go-to after addressing their issues, is to just simply say, hey, where are you from?
Mm-hmm.
You know what? I'm an Alabama guy. I've been born and raised in Birmingham, spent most of my life here, know most of the surrounding areas. Just start a conversation. And it doesn't have to be that leading question, but that's the one that I usually go with. And then that leads to, oh, yeah, certainly I have relatives there. Oh, I used to work for so and so. And it's just, generating conversation, I think, is something that just relates to people on that human level has really been beneficial for me in my practice.
Martin, how can healthcare clinicians, how can we regain that trust?
Matt has alluded to this. It's how one addresses the patient, I think, is one of the key things. Some of these patients also told me they go to the office and the nurse practitioner sees them first and they wanted to see the doctor. If, for example, the physician could just step in for a moment, just for a moment and say, this is my nurse practitioner. They're going to take care of you for now. I'm looking at your records and I'll see you on the next visit. That works. If when the doctor comes into the patient's room in the hospital, they say, I admitted you, my partner will be in tomorrow, my nurse practitioner may be in, but we're all watching your record and we all know about you, just those kinds of things really put the patient at ease and feel like the doctor is in control and that they are in good hands. The physicians have difficulty with the hospital environment, meaning if the whiteboard in front of the patient doesn't have the nurse's name on it, the time of day, the diagnosis, some of those things that are helpful for the patient to see, or if the clock is broken on the wall, well, those are all important things to the patient that make them feel like, so it's both. But I think the key for the physician is a bit more communication that really does not take up a great deal of time. And if the patient feels confidence in what the admitting doc tells them, then the admitting doc doesn't have to be there long periods of time.
Matthew, you talk about the importance of narrative medicine in terms of regaining that trust. So talk more about that.
Yeah, so narrative medicine is a field. My good friend Tom Vetter has written extensively on it. Just the idea of establishing rapport, more of the humanities-based way to approach patients. It's something that people can certainly go. There's plenty of literature out there to read about. Unfortunately, not something that has really gained a ton of traction. It's not like we have a program here at my institution. They are few and far between. But when I read about it, I really think about this idea of focusing on the patient experience, patient engagement, right? Those are things, there's been articles written that those are things that are outside of the physician's control, to which I've actually pushed back before and said, well, time out, hang on. Martin has just said patients want us to be in control. We are leaders in the healthcare system, right? So while it may not be our traditional role, if we make it our role, people will listen, right? People do listen to us in the healthcare system. So let's make patient engagement a priority. Let's make patient satisfaction a priority. Let's make patient experience a priority. That's long been a concept in business, voice of the customer, relationship marketing, et cetera. Building, harmonious experiences for patient, establishing two-way communication. Those types of concepts have been around in business for a while. So let's take those, let's make it our responsibility as the physician leaders in our institution, and then let's push that, right? Let's take that. And while it may not be our direct responsibility, we can make it our responsibility.
Fee for service versus value-based care. Sometimes fee for service increases the quantity and increases the financial incentives for physicians to see more patients, and subsequently less time is spent for each patient. How can changes in the physician payment system, do you think that can rebuild some of the trust?
Yes, I think that, the people I talk to have no issues with physicians being upper income earners. That's not the point. But it goes back to the narrative medicine. So long as they feel comfortable with the doctor, nobody minds a neurosurgeon making the highest. Nobody minds, any physician's income. I've just never heard that. But if the physician does not have the time or the ability to talk to them, that becomes the issue. One thing we haven't talked about here either is we have one of the impinging issues is a decline in public health. And so as a society, we are not seeing the public's health getting better. Part of that's access. Part of it is not all the states expanding Medicaid. We just have the whole system is kind of messed up. So it's a public health issue. It's a singular health issue. It's a community health issue. And what I am hoping to see in my lifetime actually is this return of care more in the hands of physicians, decrease in fraud, decrease in absence, meaning absence of the time spent. And yet the declining payment to physicians is a tragedy. I think it's interesting that the anesthesiologists were put back into Anthem just yesterday. If you saw that, that's a remarkable turnaround. And maybe it's a harbinger of looking at these things in much better light, hopefully.
Yeah, so I think that story that you were referring to with Anthem, I think that they had dictated how much time is suitable for a surgery. And, with the social media pushback from physicians and anesthesiologists, they rescinded that policy.
Right.
Also, great work by our parent society. The American Society of Anesthesiologists pushed hard against that. That's why advocacy is so important. So I will commend my parent society, of which I am a member, for their hard work there as well.
Social media responded too. They said, What do you mean they don't want to pay my doctor for the time he spends with me? Is he going to walk out of the room? So it was the society did great, but the public catches on. They get this stuff. You just have to let them know what's going on. They get it.
Yeah.
And they were in favor of the anesthesiologist. So
They were.
We're talking to Matthew Sherrer and Martin Nowak. Matthew is an anesthesiologist. Martin is a healthcare consultant. The Kevin MD article is Trust in American Healthcare, What's Driving the Decline. Now I'm going to ask each of you just to share some take-home messages with the Kevin MD audience. Matthew, why don't you go first?
Yeah, I alluded to it earlier. It's just the spending time with your patients, establishing a narrative, right? Just starting a conversation. They want to know that I can take care of them. They want to know that I have the expertise, that the skill to handle whatever may come while they're in the operating room. But I think, as we've alluded to throughout this episode, there's also just a certain level of comfort in knowing that I care, right? I care about them. I care about them as a person. I want to know where they're from. I want to know who's in the room with them. I know that they're going through a lot. I know they're going through a really, really hard time, and I have the privilege of being able to walk through that with them. So just if I could encourage my physician colleagues out there, all of our clinician colleagues out there, take some time, get to know your patients, and they're going through really hard stuff, and we get to be there with them.
And Martin, we'll end with you. Your take-home messages.
sure, I think that the confidence of the physician to the patient and family is returned in trust. The greater the confidence, the greater the trust. The second piece is I think if physicians will take just a bit more time, make sure the patient understands their time, meaning I'll be back tomorrow. Make sure they introduce the people that represent them. Then the patient has great trust in the physician and those that represent them. Those two things would make a world of difference in the trust issue.
Yeah.
Martin, Matthew, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you.
Yeah, good to see you. Thank you so much.